The thyroid gland is a small butterfly-shaped gland that is located at the front of the neck. It produces an hormone, which is the thyroid hormone, that controls metabolism, body temperature, heart rate, and our energy level. So before we talk about what thyroid function test is, let's look at how these hormones are produced. Firstly, the hypothalamus, which is part of the brain, monitors or controls the level of the thyroid hormone in the blood. When this level is low, it releases an hormone known as the thyrotropin releasing hormone. This hormone then goes to the pituitary gland and stimulates it into the production of the thyroid stimulating hormone. I want us to remember this fact that thyroid stimulating hormone is not produced by the thyroid gland but instead by the pituitary gland. So this thyroid stimulating hormone then stimulates the thyroid gland to produce thyroid hormone, and there are two types of thyroid hormone that is being produced, which is the T4 known as the thyroxine, and it's about 80 to 90% of the total hormone that is being produced, and the T3, which is the triiodothyronine, and is produced in small amounts into the bloodstream. In the blood, thyroid hormones are in two forms, which are the bound or the inactive form and the free or the active form. So in the bound or the inactive form, T3 and T4 bind to proteins such as albumin and thyroxine binding globulin, and these are known as total T3 and total T4 hormones. While the free and the active form, a small fraction of these T3 and T4, they are not bound to any proteins, and they are known as free T3 and free T4 hormones. So in organs like the liver, the kidney, the muscles, and the brain, T4 is converted to T3 by an enzyme known as deiodinase. That is, from T4, one iodine is removed in order to form T3. So T3 is more active than T4. Then T3 enters into the body cells and they perform their function, which is they control metabolism, heart rate, controls body temperature, and affects growth and development. While for free T4 and free T3, free T4 enters into tissues like the liver, kidney, brain, and muscles. They are converted to free T3, which then enters into the body cells to carry out their function. So free T4 is just like a reservoir for producing an active free T3. So it is important to note that free T3 and free T4 shows the true active hormone level because they are not affected by protein levels, pregnancy, liver disease, and drugs, unlike the normal T3 and the T4. So these free T3 and free T4, they are best in diagnosing thyroid disorders. After performing their function, these hormones are destroyed by the liver and they are excreted via urine and stool. When there is enough T3 and T4 in the blood, they signal the pituitary gland to reduce the production of thyroid stimulating hormone, which in turn signals the hypothalamus to reduce the production of TRH. So this is like a feedback mechanism and it keeps the system balanced. I want us to remember that TSH controls the production of T4 and T3 in the blood, and the amount of TSH the body produces depends on the amount of both T4 and T3 in the body. And also, there are two forms of T3 and T4 that exist in the blood. So since there is a relationship between TSH, T4, and T3, so whenever there is a low T4, the body increases the production of TSH to make it up. Then when there is a high T3 or T4, the body reduces the production of TSH to balance their level in the body. Thyroid function test is used to measure the level of thyroid hormone in the blood, and this level helps us understand if the thyroid gland is working normally, overactive, or underactive. The first hormone we are looking at is the thyroid stimulating hormone. So remember that it is produced by the pituitary gland in the brain, and it tells the thyroid gland how much T3 and T4 to produce. So since it basically controls the production of T3 and T4, it is the most sensitive screening test test among the hormones. So next is the triiodothyronine, which is the T3. It controls metabolism, heart rate, and body energy. So when there is a high level of T3 in the blood, it is known as hyperthyroidism. And when there is a low level of T3 in the blood, it is known as hypothyroidism, which means that the thyroid gland is underactive. While for hyperthyroidism, it means that the thyroid gland is overactive. Next is the thyroxine, which is the T4, and this is the most abundant or the main hormone produced by the thyroid gland, and it is converted into T3 in the body tissue. So if there is a high level of T4, it is known as hyperthyroidism, and if there is a low level of T4 in the blood, it is known as hypothyroidism. Next is free T4, and this is the unbound or active form of T4 in the blood, and this is the best indicator of thyroid hormone status, and it is used to monitor thyroid treatment. So high free T4 also means hyperthyroidism, and low free T4 also indicates hypothyroidism. Next is the free T3, and this is the unbound or active form of T3 available in the blood. It helps to confirm hyperthyroidism, and it is useful when total T3 is affected by protein. So if you want to get more of this content, please like and click the subscribe button.